What if I told you that the simple act of taking your blood pressure medication at the wrong time of day could be quietly putting your heart, your kidneys, and your life at serious risk, and your doctor may have never once warned you about it? If you take your blood pressure medication with your morning coffee, you need to stop what you're doing and watch this. If you take your water pill after 2 p.m., same thing. And if you've ever doubled up after missing a dose, I need to talk to you. What I'm about to cover is what your pharmacist should have told you the day you filled that prescription. The most dangerous time to take your blood pressure medication. I've seen thousands of patients on blood pressure medication. And there is one timing mistake I see every single week that most doctors never address in a 15-minute appointment. If you take your blood pressure medication in the morning or at night without knowing these specific rules, you may be cutting its effectiveness in half. Or worse, you may be creating a dangerous window where your heart and kidneys are completely unprotected. What I'm about to tell you is what I tell my own patients after the prescription is already written, the conversation that doesn't happen in the exam room. Stay with me because timing mistake number 3 is the one that surprises people the most. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. I'm Dr. Daniel. I created this channel because the information that protects people's lives in my clinic should not stay inside my clinic. With 26 years in medicine, I've watched blood pressure medication become one of the most prescribed drug classes in the United States, and most patients are told what to take, but not when, not with what, and not what to avoid. That gap in information is costing people their health. Today, I'm going to walk you through the 5 most dangerous blood pressure medication timing mistakes, the ones that create real cardiovascular risk, reduce drug effectiveness, and sometimes trigger emergency complications. And I'll tell you exactly what to ask your doctor or pharmacist before your next dose. If this kind of honest clinical information is what you want in your feed, subscribe now. It takes 1 second. I put out one long-form video every week, and this is exactly the kind of thing I cover. Mistake number 1, a morning versus bedtime dosing ACE inhibitors and ARBs. Let me start with a class of blood pressure medications most seniors are on. ACE inhibitors and ARBs drugs like linenopril, Ramapil, Lartine, and Valcartine. These are prescribed to millions of people every single day. For decades, the default instruction was take once daily in the morning. It was a convention, not necessarily evidence-based, but research has shown that patients who took their blood pressure medication at bedtime had significantly better cardiovascular outcomes than those who took it in the morning. Lower rate of heart attack, lower rate of stroke, lower rate of death from cardiovascular causes. Why? Because blood pressure follows a natural rhythm. It dips during sleep, then surges sharply in the early morning hours. We call this the morning surge. That surge is when heart attacks and strokes are most likely to occur. A medication taken at bedtime is still active, clears throat, during that vulnerable morning window. A medication taken in the morning may have already peaked and begun declining by the time the danger arrives. This isn't a minor optimization. The difference in cardiovascular outcomes between morning and bedtime dosing is clinically meaningful. And yet the default prescription instruction take in the morning massa hasn't changed for most patients. I want to be honest with you, the science on this is still evolving. Some studies show a clear benefit to bedtime dosing. Others show no significant difference. The right answer depends on your specific medication and your specific blood pressure pattern. What I tell patients, ask your prescribing physician, should I be taking this at bedtime instead of in the morning? That one question is worth asking. If they can give you a personalized answer, great. If they've never considered it, that tells you something too. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now, let's move on to point number 2. Mistake number 2, grapefruit and calcium channel blockers. This one surprises people every single time. I have had patients who were doing this every morning without any idea it was a problem. Grapefruit and grapefruit juice contain compounds called furanumeranes. These compounds block an enzyme in your digestive system called CYP3A4. That enzyme is responsible for breaking down many blood pressure medications, specifically calcium channel blockers like felotapine, nifedipine, and amlopin. When that enzyme is blocked, your medication doesn't get processed normally. Blood levels of the drug rise dramatically, sometimes to dangerous levels. The result, an exaggerated drop in blood pressure, dizziness, fainting, and in some cases, dangerous arrhythmias. Here's what makes this particularly serious. The effect of grapefruit can last up to 24 to 72 hours after you consume it. This is not just about the moment you eat it. A glass of grapefruit juice in the evening can affect your medication the following morning. If you take any calcium channel blocker for blood pressure, ask your pharmacist directly. Is grapefruit a concern with this specific drug? Don't assume the answer is no. Ask. It is a simple question that could prevent a serious complication. This is not something that gets printed on a prescription label in bold letters. It doesn't come with a warning most patients notice. And yet, for those on the affected medications, it is a real and significant risk. If you're a senior managing multiple prescriptions, this is one of those interactions that genuinely matters. I've seen patients who were eating half a grapefruit every morning as part of what they considered a healthy breakfast routine. Doing exactly the right thing, they thought, and unknowingly disrupting the way their blood pressure medication worked, not because they weren't careful, because no one told them. Mistake number 3, taking your diuretic too late in the day. This is timing mistake number 3, and this is the one that surprises people the most because it's not about drug interactions or food. It's about something much simpler, and the consequences are serious. Diuretics, water pills, are one of the most commonly prescribed components of blood pressure treatment. Medications like hydrochloroioid, phytoamide, and chloroidone work by making your kidneys excrete more fluid, which lowers blood volume and reduces pressure. The timing problem is this: many patients are taking their diuretic in the late afternoon or evening, sometimes because they forgot their morning dose, sometimes because they were never given specific timing instructions. When a diuretic is taken too late in the day, you get the predictable consequence: frequent urination at night. Most patients accept this as normal. It is not normal. It is a preventable side effect of incorrect timing. And here's what I want you to understand about why this matters beyond just sleep disruption. Every time an older adult gets out of bed in the middle of the night in the dark, sometimes disoriented with blood pressure that may shift when they stand, the risk of a fall increases significantly. Nighttime falls in older adults are a leading cause of hip fractures. Hip fractures in patients over 70 carry a 1-year mortality rate of 20 to 30%. That is the real consequence of taking your diuretic at 6 p.m. instead of 8 a.m. That is not a side effect. That is a chain of events, a preventable chain of events that begins with a timing mistake that most patients don't even know they're making. The rule I give every patient: if you're on a diuretic, take it in the morning, ideally before 10 a.m., so that the peak effect runs through the day, not the night. If you're on a twice daily diuretic, the second dose should be taken no later than 2 p.m. After that, you are setting yourself up for nighttime disruptions that carry real physical risk, especially for seniors living alone or with limited mobility. This one change, just taking the medication at the right time, can prevent a fall that could change the entire trajectory of your health. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now, let's keep going with point number 4. Mistake number 4, beta blockers in your morning coffee. Most people who take beta blockers, medications like metoprolol, Atenol, Carvedi, Carvitul, and propranolol, take them in the morning. And most of those people have their morning coffee at the same time or shortly after. Here's what's happening in your body when you do this. Caffeine is a stimulant. It activates your sympathetic nervous system. It raises your heart rate and temporarily elevates your blood pressure. Beta blockers work by blocking that exact sympathetic activation, slowing the heart rate and reducing the force of heart contractions. When you take a beta blocker at the same time as a significant amount of caffeine, you are simultaneously pressing the gas pedal in the brake. In most patients, the medication wins. But in patients with certain cardiac arrhythmias, the combination can trigger palpitations or irregular heartbeats during the period when caffeine peaks roughly 30 to 60 minutes after ingestion. There is also evidence that caffeine can interfere with how certain beta blockers are metabolized, particularly metoprolol, in patients with specific genetic variants affecting drug processing enzymes. For most people, this isn't a dramatic risk, but for those with a history of arrhythmia, it is a combination worth discussing with your cardiologist or prescribing physician. My recommendation: if you are on a beta blocker for blood pressure or a heart condition, wait at least 30 to 45 minutes between taking your medication and drinking a cup of coffee. It is a small change. It costs you nothing. It doesn't mean giving up coffee. It just means creating a window between the medication and the caffeine so the two aren't competing in your system at the same moment. For most patients, this is a low-stakes adjustment. For patients with arrhythmia history, it may be clinically meaningful, and if you drink multiple cups in the morning, which many seniors do, That's worth bringing up with your physician as a specific conversation about your situation. Mistake number 5, doubling up or skipping doses without a plan. This is the timing mistake I see most frequently, and the one with the most variability in how dangerous it can be, depending entirely on which medication you are taking. A patient misses their morning blood pressure pill. They remember at noon or at 3 p.m. or at dinner. The common instinct is, I'll just take 2 tonight to make up for it. For some medications, this is relatively low risk. For others, particularly calcium channel blockers, certain ARBs and beta blockers, doubling a dose can cause a sudden significant drop in blood pressure, dizziness, fining, and in older adults with reduced vascular tone, a fall. The same fall risk we talked about in mistake number 3, triggered not by poor timing but by a well-intentioned attempt to catch up. There is a second version of this mistake that I see just as often. Patients who are prescribed twice daily medications start taking them once daily because it is easier to remember, often without telling their physician. The blood pressure is partially controlled. The physician sees numbers that look acceptable. The medication dose is never adjusted, and the cardiovascular protection the patient should have is incomplete. That is not a small gap. If your twice daily blood pressure medication is meant to provide consistent 24-hour coverage and you're only dosing once, there are hours in your day where your blood pressure may be elevated and uncontrolled, and neither you nor your doctor knows it because the readings at the appointment happen to fall during the window when you are covered. The standard guidance is this: if you miss a dose and it is still the same day, take it as soon as you remember, unless it is close to the time of your next dose. In that case, skip the missed dose and resume your normal schedule. Never double up without asking your physician or pharmacist first, because the answer depends entirely on which medication you are taking. What is safe with one drug may be genuinely dangerous with another. Important warning: before we go any further, I need to pause and say something directly to you. Everything I have shared in this video, every timing rule, every drug interaction, every clinical pattern is for educational and formational purposes only. It is not medical advice. It is not a substitute for a conversation with your doctor, your cardiologist, or your pharmacist. And it is absolutely not a reason to stop taking your medication, skip a dose, or change your routine without professional guidance. I want to say that again because it matters. Do not stop taking your blood pressure medication without speaking to your doctor first. Even if something in this video surprised you, even if you feel fine, even if you think your numbers look good, stopping blood pressure medication abruptly or reducing your dose without supervision can cause a sudden and dangerous spike in blood pressure that puts you at immediate risk for a heart attack or stroke. That is not a risk worth taking. Blood pressure is called the silent killer for a reason. Most people with high blood pressure feel no symptoms at all. That means you cannot feel whether your blood pressure is under control. You can only measure it, and you can only manage it safely with consistent medically supervised treatment. Feeling well does not mean your blood pressure is well. Please remember that this channel exists because I believe patients deserve honest, complete information. Too often, people leave a 15-minute appointment with a prescription in hand and almost no context for how to use it safely. That gap in information is what I am trying to close. Not to replace your physician, but to help you show up to that appointment better prepared. The information I share here is based on peer-reviewed clinical research, established medical guidelines, and 26 years of practicing medicine. But medicine is not one-size-fits-all. Every person is different. Every medical history is different. What is true for most patients may not be true for you. That is why your physician's guidance based on your full history, your labs, your other medications, and your individual risk factors will always take priority over anything you hear in a video. If you are currently experiencing chest pain, sudden dizziness, a severe headache, vision changes, shortness of breath, or any symptom that concerns you, please stop watching right now and call 911 or your local emergency services immediately. Those are not symptoms to research online. Those are symptoms that require immediate medical attention. If something in this video raised a question for you, if you are unsure about your medication timing, if you are not sure whether grapefruit affects your specific drug, if you have been missing doses and do not have a plan, write it down and bring it to your next appointment. That is exactly what this video is designed to help you do. Ask the questions. Have the conversation. Let your doctor give you a personalized answer. This content is not sponsored. I have no financial relationship with any pharmaceutical company. My only interest is in giving you the kind of clear, honest clinical information that helps you take better care of yourself and ask smarter questions of the people responsible for your care. Take your medication, follow your doctor's instructions, and use what you learn here to have a more informed conversation, not to make decisions on your own. Our closing, I want to be clear about something before we finish. Blood pressure medication saves lives. The evidence for treating hypertension is among the strongest in all of cardiovascular medicine. I am not telling you to stop your medication. I am not telling you your doctor made a mistake. What I am telling you is that the conversation about timing, about when you take it, what you take it with, and what happens if you miss a dose, is a conversation that often doesn't happen in a 15-minute appointment. And that gap in information has real consequences for real patients. I've seen it across 26 years of practice. The medication is right, the dosage is appropriate, but the timing is off and the outcomes suffer. If you are over 60 and taking blood pressure medication, or if someone you love is, here are the 5 questions to bring to your next appointment. 1. Should I be taking my medication in the morning or at bedtime? 2. Are there food, supplements, or drinks I need to avoid around my dose? 3. What should I do if I miss a dose? 4. Is there a specific time of day when my blood pressure tends to be highest? 5. Are there any timing interactions with my other medications? Those 5 questions asked clearly will do more for your cardiovascular protection than anything I can tell you in a YouTube video because your physician has access to your full history. I don't. But I can give you the questions and I can make sure you know they're worth asking in the first place. If this gave you something useful, something you didn't hear in your last appointment, please share it with someone you care about who is managing their blood pressure, and subscribe because every week I'm going to keep giving you the clinical information that I believe every patient deserves. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.